Hey guys, welcome back to our channel. In today's video, we will discuss about contraceptives. Contraceptives are the measures that are used for the purpose of preventing pregnancy due to coital act. The contraceptives are broadly divided into two categories, which are temporary methods and another one is permanent. The temporary methods are reversible, whereas permanent methods are irreversible. The temporary methods of contraceptions are subdivided into natural contraception, barrier methods, intrauterine contraceptive devices, and steroidal contraception, in which the natural contraceptions and barrier methods are known as fertility awareness method. In permanent, for female, we are using tubectomy, and for male, we are performing vasectomy. Let's discuss the each methods of contraception one by one in detail. Natural contraception. It includes three methods which are rhythm method, coitus interrupts, and lactation amenorrhea. Rhythm method. It is based on the identification of fertile period of a cycle and to abstain from sexual intercourse during this period. The methods to determine the approximate time of ovulation and the fertile period includes recording of previous menstrual cycle, which is known as calendar rhythm, and noting the basal body temperature and recording it. It is known as temperature rhythm, and noting excessive mucoid vaginal discharge, which is known as mucus rhythm. Also, it is known as Prilling's method. For users of calendar rhythm, the unsafe day is obtained from subtracting 18 days from the shorter cycle and deducting 10 days from the longer cycle. For example, if a woman's shorter cycle is 28 and longer cycle is 35 means she have to subtract 18 from 28 and 10 from 35. Here we got 20, 10 and 25. It means she have to avoid intercourse during 10 to 25 days of her menstrual cycle. And uses of temperature rhythm requires abstinence until the third day of rise of temperature. For uses of mucus rhythm requires abstinence from all days of noticeable mucus and for 3 days after that. The failure rate of rhythm method is 20 to 30. Then coitus interrupts. It is the oldest and most widely acceptable contraception method by a man, in which the men have to withdraw his penis shortly before ejaculation. It requires sufficient self-control by the men. The failure rate of coitus interrupts is 20. Then lactational amenorrhea. Prolonged and sustained breastfeeding offers natural protection of pregnancy. When women breastfeed, this will increase the hormone prolactin. This increased prolactin level will lead to suppression of GnRH hormone release from the hypothalamus. This leads to decreased level of estrogen and luteinizing hormone, which are the essential for ovulation and menstruation. Important point: when woman who is on exclusively breastfeed, she have to take contraceptive methods from the third month of their postpartum period. When woman who is on partially breastfeed, she have to start her contraceptives method from third week of the postpartum period. Let's solve this MCQ. What is the fertile period in the rhythm method of contraception for a woman with menstrual cycle between 26 to 33 days? To solve this, we have to apply the formula which we seen earlier. In this, we have to subtract 18 from 26 because which is the shortest cycle, and we have to subtract 10 from 33 because which is the longest cycle. Here we got 18 and 23, which means she have to abstain from her intercourse during 8th to 23rd day of her menstrual cycle. Moving into the barrier methods, the aim of barrier method is to prevent live sperm from meeting ovum. Barrier methods also provide some protection against sexually transmitted diseases such as chlamydia, gonorrhea. The barrier method is divided into three categories, which are mechanical, chemical, and combination of mechanical and chemical. This mechanical method is also known as physical methods, which includes male condom, female condom, diaphragm, and cervical cuff. Chemical methods, which are mainly vaginal contraceptives. This is of four categories, which are foam, creams, and suppositories and soluble films. Last one, the combination of mechanical and chemical, which includes today's sponge. Let's see about male condom. It is referred to as external condom. It is made up of polyurethane or latex. The polyurethane is thinner and suitable for those who are sensitive to latex or rubber. In India, one particular brand is widely marketed as Niroth. The efficacy of this condom can be improved by increasing or adding spermicidal agents during its use. The advantages of this condom are it is easily available, safe and inexpensive. There is no side effect while it is used. And the biggest advantage of this condom is it is also provide protection against sexually transmitted diseases. The disadvantages of this condom are may slip off or tear during intercourse due to incorrect use. The failure rate of this condom is 15. Next, female condom. It is referred to as internal condom. Female condom is a pouch made up of polyurethane which lines the vagina. It has got two rings. Internal ring of closed end covers the cervix, while external ring remains outside the vagina. It is lubricated with silicone. MCQ point male condom it is coitus dependent because male condom have to be inserted while the penis is in erectile stage. It depends upon the act of coitus, whereas female condom it is coitus independent. It should be inserted before the act of coitus. Next, diaphragm. Diaphragm is a vaginal barrier and is also known as douche cup. Diaphragm is a shallow cup which is made up of plastic or synthetic rubber. It requires healthcare professional to measure the size of the device. It should completely cover the cervix. While using diaphragm, additional chemical spermicidal agent should be placed on the device prior or during insertion. The device is introduced 3 hours before intercourse and is to be kept for at least 6 hours after intercourse. The advantage of this diaphragm is there is no risk or medical contraindication with it. The disadvantages are there is need for trained person to initially demonstrate the technique of insertion. And since the diaphragm is left in vagina for an extended period of time, there is a chance of toxic shock syndrome. The failure rate of diaphragm is 16. Next, chemical methods. This chemical method includes spermicides, which are available as vaginal foams, gels, creams, tablet, and suppositories. Usually, the chemical methods contain surfactant like non-xylene, autoxinol, or benzylconium chloride. This cream or jelly is introduced high in the vagina with the help of applicator. Usually, these chemical methods such as spermicides are not used alone. It is used either with condom or diaphragm in order to increase the efficacy of the barrier method. Let's see about today's sponge. It is made up of polyurethane which is impregnated with 1 gram of nanoxylene as a spermicide. This nanoxylene which kills the sperm. It releases the spermicide during coitus which absorbs the ejaculate and also it blocks the entrance of cervical canal for the sperm. The sponge should not be removed for 6 hours after intercourse. The advantage of the sponge is there is no need for other contraceptives such as chemical contraceptives, spermicides. The disadvantage is there is an increased risk for toxic shock syndrome because the sponge is kept inside the vagina for a longer time. The failure rate of this today's sponge is 16 to 32. Let's see about cervical cap. The cervical cap, also known as FEM cap, which is made up of silicone rubber and it is also offered in various sizes and it's used similarly to a diaphragm. It is inserted over the cervix and contains spermicides. It can be left in place for up to 48 hours. Cervical cap may not be suitable for women who have previously given birth because the shape of cervix may not offer secure fit of the cap. Let's discuss about intrauterine devices. Intrauterine device is a small device which is inserted into the uterus to prevent pregnancy. Mainly two types are there. One is medicated and another one is non-medicated. Both are made up of polyethylene or other polymerase. Medicated intrauterine devices releases either metal ion such as copper or hormone such as progesterone. Non-medicated intrauterine devices are first generation. Intrauterine devices which releases copper ion is second generation. Intrauterine devices which releases hormone is third generation. Parts of intrauterine devices T-shaped, which is horizontal arm. It is vertical stem. It contains progesterone or copper, and last one is string or thread. First generation intrauterine devices, which are inert and non-medicated devices. Examples are Lippis loop, spirals, coils, rings, and bows. Lippis loop contains small amount of barium sulfate to detect it in X-ray. After incision, tail of Lippis loop made up of nylon projected outside the vagina. It helps us to ensure it in place. There are four sizes of Lippis loop are present from A, B, C, D, in which A is smallest and D is the largest. Larger lipid loop has more anti-fertility effect, whereas lower expulsion rate, but it has more side effect. Larger size suits multiparous women. The mechanism of action of lipase loop are causing inflammatory response which releases product like toxic to sperm and embryo. Second generation intrauterine devices. The second generation intrauterine devices have copper. Examples are early devices such as copper 7, copper T200. Newer devices, variants of T devices such as copper T220C and copper T380A, and Nova T multi-load devices, a multi-load 250 and multi-load 375. The mechanism of action of copper T device is preventing blastocyst implantation through enzymatic interference. Third generation intrauterine devices, which are hormone releasing intrauterine devices. Examples are progesterone and Mirena. Progesterone, it is widely using hormonal device. It has got T-shaped and it is filled with 38 milligram of progesterone. This hormone is released at the rate of 65 microgram per day. It acts on uterine lining, cervical mucosa, and sperms to prevent fertilization. Hormonal supply diminished over a period of time, so regular replacement is needed. Next, Mirena. It is another third generation intrauterine device which releases 20 microgram levonorgestrel. Advantage of this includes low menstrual blood flow and fewer days of bleeding. Duration of use of intrauterine devices. For lipase loop as long as record. For copper T380A 10 years. For copper T200 3 years. For Nova T 3 years. For multi-load 375 it is 5 years. For multi-load 250 it is 3 years. Progesterone releasing intrauterine device every year and levonorgestrel intrauterine device it is 7 years. Advantages of intrauterine devices. It is simplicity and easy to insert and no hospitalization is recorded. Insertion takes only few minutes. Once inserted can be used for longer duration and it is inexpensive. Contraception is reversible by removing it. The disadvantages of intrauterine devices are painful placement, irregular periods, risk for cervical inflammation and risk for ectopic pregnancy. Timing of insertion of intrauterine devices. Best time for insertion is during menstruation or within 10 days of beginning of menstrual period. Immediate postpartum insertion occurs within the first week of delivery before the woman leaves the hospital. It can be inserted within 48 hours following delivery. Post-pubertal insertion occurs 6 to 8 weeks of following delivery. Post-placental insertion occurs it done within 10 minutes after the expulsion of placenta. In LSC's delivery, IUCD can be inserted after removing the placenta. Contraindications to insertion of intrauterine devices. Absolute contraindications are suspected pregnancy, pelvic inflammatory diseases, vaginal bleeding of undiagnosed cause, and cancer of genital organs, and previous ectopic pregnancy. Relative contraindications are anemia, menorrhagia, history of pelvic inflammatory diseases, purulent cervical discharge, and distortion of uterine cavity due to congenital anomaly. The most common complication associated with intrauterine device is bleeding. The second most common complication associated with intrauterine device is pain, and it is the most common reason for removal of intrauterine device before completing shelf life. Let's solve this MCQ. Lippis loop is a type of contraceptive used as cervical barrier, vault barrier, non-medicated intrauterine devices, copper releasing devices. The correct answer is non-medicated intrauterine devices because Lippis loops are comes under first generation intrauterine devices. The first generation intrauterine devices are usually non-medicated. Let's discuss about steroidal contraceptives, also known as hormonal methods, which is four categories, which are oral, parenteral, devices, and patches. In oral, combined preparation like combined oral pills and single preparation mini pill and estrogen only pill. Parenteral, which are injectable and implant. In injectable, it includes DMPA and NETAN, implant, implant and not plant too, and devices such as intrauterine devices, which we discussed earlier, and vaginal ring such as LNG ring and combined estrogen progesterone ring, and transcervical Assure and Diana. In patch such as intratransdermal patch. Let's see about combined oral contraceptive pills, which contains low doses of two synthetic hormones such as progestin and then estrogen. Combined pills are safe and effective. It should not be given to breastfeeding women till the 6 months of postpartum. Pill should be taken every day at a fixed time, preferably before going to the bed. One pill is taken every day for the better results. A woman must take pills every day without delay or any break. The pill contains 28 tablets. In 28, 21 tablets are contraceptive pills and the other 7 are iron tablets. Missing pills can increase the risk of unwanted pregnancy. If a woman forgot to take pill, she should take it as soon as possible, she remembers, and continue the remaining pills at usual time. Types of pills. Government of India has made available two types of pills known as Mala N and Mala D. Mala D is available to the customer at the rate of 3 rupees per pack. Mala N is free of cost through all PHCs. These pills contain levonorgestrel at the rate of 0.15 mg and ethyl estriol at the rate of mechanism of action of the combined contraceptive pills. The estrogen present in the pills will suppresses the FSH and progesterone in this pill will suppresses the LH. This leads to inhibition of ovulation. The non-contraceptive benefits of these pills are reducing bleeding and regulates the menstrual cycle, reduce the risk of pelvic inflammatory diseases and decreases the acne. And other benefits are protection given against endometrial ovarian cancer, iron deficiency anemia, polycystic ovarian syndrome, and endometriosis. Next, progesterone only pills. It is also known as mini pill or micro pill. It contains only progestin at a minimal amount. It has to be taken daily from first day of cycle. It has no side effect or adverse effect on lactation, so it is also known as lactational pills. Mechanism of action of these pills are it works by mainly making cervical mucus thick and viscous, thereby prevents sperm penetration. Next, the newer contraceptive Chaya and Saheli. Saheli is a non-steroid, non-hormonal contraceptive composed with ormilofixin 30 mg. Saheli was developed by Central Drug Research Institute, Lucknow. It is available with the market name under Centromium 30. There are estrogen derivative contraceptives. For the first 3 months, tablets need to be taken twice weekly, followed by once per week. First pill taken on the first day of period and second pill on the fourth day of period, and the pattern of taking will be continued. The mechanism of action of this drug is it works primarily by preventing implantation of fertilized ovum. Council of Scientific and Industrial Research claims that Chaya is world's first non-steroidal birth control pill. It is free of cost and it is part of Asha kit. Each Chaya package contains 8 tablets. Let's discuss about injectable contraceptives. The injectable contraceptives contain synthetic hormones that resembling the natural female hormones. When administered intramuscularly or subcutaneously, there is a slow release of hormone into the bloodstream and it provides protection from pregnancy for a long period of time. There are two types of injectable contraceptives. One is progesterone only injectables and another one is combined injectable contraceptives. This progesterone only injectable includes DMPA and norethistron enthanate. This DMPA, which means depot metroxyprogesterone acetate, which comes in two forms. One is intramuscular form and another one is subcutaneous form. This intramuscular form dose is 150 mg for every 3 months, whereas the subcutaneous form is 104 mg for every 3 months. It acts by suppressing ovulation and thickening of cervical mucosa and thinning of endometrial lining. The initial dose is given within the first day of 5 days of menstrual cycle, and it is also safe during breastfeeding. Norethistron Ethernet. The dosage is 200 mg IM for every 2 months. It acts by inhibiting ovulation and progesteronic effect of cervical mucosa. The initial dose is given within first 5 days of menstrual cycle. Next, combined injectable contraceptives. This injectable contraceptive contains progesterone and estrogen. It is given at monthly interval plus or minus 3 days. It acts by suppressing ovulation and thickening cervical mucosa and makes endometrium unfavorable for implantation. This is not suitable for women who is on breastfeeding until 6 months of postpartum period. And important point is government of India providing this DMPA free of cost under the brand of Let's see about vaginal rings. Vaginal rings contain levonorgestrel. It consists of a flexible ring that is placed in the cervix and keeps on releasing hormones. The woman herself has to replace it once a month after 3 weeks. In the fourth week, the woman will have her period, and the following week, a new ring will be put in place. Let's see about birth control patch. It is a small patch that is applied to the skin that releases hormones on an ongoing basis. It is changed once a week, and even though it is usually eye accurate, it may be less effective in women who are overweight. The birth control patch can be attached to the skin on different areas of your body like buttocks, abdomen, upper torso and upper or outer arm. The disadvantage of these contraceptive patches are light intermenstrual bleeding and skin irritation, possibility of detachment. Let's discuss about permanent method of contraception. It is also known as sterilization. It is provided free of cost in government institutions in India. Guidelines for sterilization. Age of husband should be between 25 to 50 years. For wife, it should be between 20 to 45 years. Motivated couple should have 2 children at the time of sterilization procedure. Male sterilization. It is also known as vasectomy. It prevents the exit of spermatozoa from the testes, thereby eliminating their presence in the ejaculate. After sterilization procedure, the client does not become sterile immediately after surgery. It takes 30 more ejaculation to become sterile. So advise the client to take additional contraceptives for 3 months. Avoid cycling and heavy lifting for 2 weeks after surgery. Stitches will be removed on 5th post-operative day. Female sterilization. It is also known as tubectomy or tubal ligation. It blocks the passage of egg through the fallopian tubes. It is mainly of two types are there. One is laparoscopy and another one is mini lap operation. Laparoscopy. Female sterilization is done through abdominal approach using laparoscopy. Fallopian rings are applied to occlude the tube. And mini lap operation, it is done under local anesthesia and by creating small incision on the abdomen. In this, fallopian tube will be clamped. At last, this is a question for you. What is the duration of novelty? The options are 5 years, 3 years, 7 years and 10 years. Comment your answers in the comment box. That's all for today. If you like this video, share it to your friends and subscribe to our channel for more updates. See you in the next one.